Tinnitus is often described as a persistent ringing, buzzing, hissing, or roaring sound heard in one or both ears, or even in the head, without any external source. This phantom noise can range from a mild annoyance to a profoundly debilitating condition, significantly impacting daily life and overall well-being. For many, it's a constant companion that disrupts sleep, concentration, and peace of mind. While often associated with hearing loss or inner ear damage, the underlying causes of tinnitus are far more complex and varied than simple auditory issues. It's a symptom, not a disease, and its origins can be deeply rooted in various bodily systems. Understanding these less obvious factors is crucial for effective management and relief. This discussion will delve into the hidden culprits behind sudden or persistent tinnitus, moving beyond the commonly known explanations. We will explore how different parts of your body, from your jaw to your nervous system, can contribute to these phantom sounds. More importantly, we will uncover natural, holistic strategies designed to reset your nervous system and alleviate your symptoms. Our focus is on empowering you with knowledge and practical tools to address tinnitus from a comprehensive perspective. By understanding the intricate connections within your body, you can begin a journey toward greater calm and reduced auditory distress. This approach emphasizes your body's innate ability to heal and adapt, offering hope and actionable steps. One often overlooked area contributing to tinnitus involves musculoskeletal issues, particularly those affecting the jaw and neck. The intricate network of nerves and muscles in these regions has a profound connection to your auditory system. Addressing these physical imbalances can often lead to significant relief. Temporomandibular joint, or TMJ, disorders are a significant factor in many cases of tinnitus. The TMJ connects your jawbone to your skull, and dysfunction here can cause pain, clicking, and even referred sensations like ear ringing. The close proximity and shared nerve pathways between the jaw muscles, nerves, and the inner ear mean that tension or misalignment in the TMJ can directly influence auditory perception. Beyond the jaw, cervical spine issues such as misalignments or chronic muscle tension in the neck can also play a crucial role. The nerves that run through your neck, particularly those in the upper cervical region, are intimately connected to the auditory pathways. Irritation or compression of these nerves can send aberrant signals that the brain interprets as sound. This connection highlights why physical therapy or chiropractic adjustments can sometimes be surprisingly effective for tinnitus sufferers. Releasing tension and restoring proper alignment in these areas can reduce nerve irritation and, consequently, the perception of phantom sounds. It underscores the body's interconnectedness and the importance of a holistic assessment. The brain's interpretation of signals and its overall state of arousal are profoundly influential in the experience of tinnitus. Stress and anxiety, while not direct causes of inner ear damage, play a crucial role in how tinnitus is perceived and amplified. They can turn a subtle internal sound into a debilitating roar. Chronic stress and anxiety lead to an overstimulation of the autonomic nervous system, specifically activating the fight or flight response. This heightened state of arousal makes the brain more vigilant and sensitive to internal signals, including those that might otherwise be ignored. The nervous system becomes hyper-aware, amplifying the perception of phantom sounds. This increased sensitivity means that even minor internal noises, which a calm nervous system would filter out, become prominent and distressing. The brain's auditory pathways can become dysregulated, leading to a vicious cycle where anxiety worsens tinnitus, and tinnitus, in turn, fuels anxiety. Breaking this cycle is key to finding relief. Understanding this neurological and psychological component is vital for effective management. It emphasizes that tinnitus is not just an ear problem, but a brain problem, influenced by our emotional and mental states. Strategies that calm the nervous system can therefore be incredibly powerful in reducing the perceived intensity and distress of tinnitus. Our diet and nutritional status profoundly impact nerve function and overall bodily health, including the delicate mechanisms involved in hearing. Nutritional deficiencies can sometimes be a hidden contributor to tinnitus, affecting the health of auditory nerves and the brain's ability to process sound correctly. Addressing these deficiencies can offer a pathway to relief. Magnesium is a vital mineral involved in over 300 biochemical reactions in the body, including nerve transmission and muscle function. A deficiency in magnesium can lead to increased nerve excitability and muscle spasms, potentially contributing to the perception of tinnitus. Ensuring adequate magnesium intake supports healthy nerve function. Zinc is another essential trace element with a significant role in immune function and cellular health, particularly within the inner ear. Studies have shown that some individuals with tinnitus have lower levels of zinc, and supplementation has been observed to improve symptoms in certain cases. Zinc supports the health of auditory hair cells and nerve pathways. B vitamins, especially B12, are crucial for nerve health and the formation of myelin, the protective sheath around nerve fibers. A deficiency in B vitamins can impair nerve function and contribute to neurological symptoms, including tinnitus. Ensuring a full spectrum of B vitamins supports the integrity of the auditory nervous system. A balanced, nutrient-rich diet is fundamental for supporting overall nerve health and reducing inflammation, which can indirectly impact tinnitus. Identifying and correcting specific nutritional deficiencies can be a powerful yet often overlooked step in managing and alleviating tinnitus symptoms. While medications are designed to treat various conditions, some can have unintended side effects, including triggering or worsening tinnitus. These are known as ototoxic agents, meaning they can be toxic to the ear. It is crucial to be aware of these potential culprits and discuss any concerns with your healthcare provider. Aspirin, particularly in high doses, is a well-known ototoxic medication that can induce or exacerbate tinnitus. While often used for pain relief or cardiovascular health, its impact on auditory function should be considered. The effects are often reversible once the medication is discontinued. Certain antibiotics, such as aminoglycosides, are also recognized for their ototoxic potential. While life-saving in many situations, their use requires careful monitoring due to the risk of hearing damage and tinnitus. Other classes of antibiotics can also occasionally contribute to auditory symptoms. Diuretics, some antidepressants, and even certain over-the-counter pain relievers can also be implicated in tinnitus. The mechanism often involves affecting blood flow to the inner ear or directly damaging hair cells. Always review your medication list with your doctor if you experience new or worsening tinnitus. Understanding the pharmacological factors is essential for identifying potential triggers and making informed decisions about your health. Never discontinue prescribed medication without consulting your doctor, but be proactive in discussing any concerns about medication-induced tinnitus. The human nervous system is an incredibly complex and remarkably adaptable network. This inherent adaptability is a core principle that offers immense hope for those experiencing tinnitus. It means that your brain and body are not fixed in their current state, but possess the capacity to change and heal. Even when faced with persistent symptoms like tinnitus, the nervous system can be retrained and rebalanced. By addressing the underlying causes and consistently implementing supportive strategies, it is possible to reduce the intensity and distress associated with the phantom sounds. This process involves shifting your body's physiological response. Achieving this reset requires a multi-pronged approach, recognizing that tinnitus often stems from a combination of factors. There is no single magic bullet, but rather a holistic integration of various techniques that work synergistically. Patience and consistency are key to allowing your nervous system to adapt and find a new equilibrium. Embracing this principle of adaptability empowers you to take an active role in your healing journey. It shifts the focus from merely coping with symptoms to actively engaging in practices that promote nervous system health and resilience. Your body has an incredible capacity for self-regulation and repair. Given the significant role of stress and anxiety in amplifying tinnitus, mind-body techniques are indispensable for calming the nervous system. These practices help to shift your body out of a heightened state of arousal, reducing the brain's sensitivity to internal sounds. They are powerful tools for self-regulation. Meditation, even for just a few minutes daily, can profoundly calm the nervous system. By focusing on the breath and cultivating present moment awareness, meditation helps to quiet the mind and reduce the stress response. This practice can decrease the perceived loudness and intrusiveness of tinnitus. Deep breathing exercises are an immediate and effective way to reduce anxiety and activate the parasympathetic nervous system, which is responsible for rest and digest functions. Slow, diaphragmatic breathing signals safety to your brain, lowering heart rate and blood pressure, and promoting a sense of calm. Regular practice can significantly impact your baseline stress levels. Yoga combines physical postures, breathing techniques, and meditation to promote overall nervous system regulation. It helps release physical tension, improves circulation, and fosters a deeper connection between mind and body. The gentle movements and mindful focus can reduce stress and enhance your ability to cope with tinnitus. Incorporating these mind-body practices into your daily routine can create a profound shift in your nervous system state. They empower you to actively manage stress, reduce anxiety, and ultimately diminish the impact of tinnitus on your life. Consistency is the most important aspect of these powerful techniques. Nourishing your body with the right foods is a fundamental step in supporting nerve health and promoting a balanced nervous system. Dietary adjustments can directly impact the physiological environment that either exacerbates or alleviates tinnitus symptoms. Focusing on nutrient-rich whole foods is paramount. Prioritize a diet rich in whole, unprocessed foods, including plenty of fresh fruits, vegetables, lean proteins, and healthy fats. These foods provide the essential vitamins, minerals, and antioxidants necessary for optimal nerve function and overall cellular health. A balanced diet supports your body's natural healing processes. Specifically, include foods high in magnesium, such as leafy greens, nuts, seeds, and dark chocolate, to support nerve transmission and muscle relaxation. Incorporate zinc-rich foods like oysters, beef, pumpkin seeds, and legumes to aid inner ear health. Ensure adequate intake of B vitamins through whole grains, eggs, and fortified foods to protect nerve integrity. Equally important is limiting substances that can exacerbate tinnitus. Caffeine and alcohol are known stimulants that can increase nervous system arousal and blood flow, potentially intensifying the perception of tinnitus. Reducing or eliminating these can often lead to a noticeable improvement in symptoms. Making conscious dietary choices is a powerful, natural strategy to support your nervous system and reduce the burden of tinnitus. It's about providing your body with the building blocks it needs to function optimally and maintain a state of calm. For tinnitus linked to musculoskeletal issues, targeted physical interventions can provide significant relief by addressing the root mechanical problems. These approaches focus on restoring proper function and reducing nerve irritation in the jaw and neck. They are often a crucial component of a comprehensive treatment plan. Physical therapy for TMJ disorders involves exercises to improve jaw mobility, reduce muscle tension, and correct alignment. A skilled physical therapist can identify specific dysfunctions and provide techniques to alleviate pressure on surrounding nerves and structures. This can directly impact tinnitus originating from jaw issues. Addressing cervical spine issues often involves a combination of physical therapy, massage, or chiropractic adjustments. These interventions aim to correct misalignments, release muscle spasms, and improve posture in the neck and upper back. Reducing nerve irritation in this region can significantly lessen tinnitus symptoms. Massage therapy can be particularly effective in releasing chronic tension in the neck, shoulders, and jaw muscles. By improving blood flow and reducing muscle tightness, massage can alleviate pressure on nerves that may be contributing to auditory disturbances. Regular sessions can help maintain muscle relaxation. These physical interventions work by restoring structural balance and reducing neurological irritation, allowing the nervous system to calm down. Consulting with a qualified professional in these fields can help identify if musculoskeletal factors are contributing to your tinnitus and guide you toward appropriate treatment.